Hi, my name is Korina Simien, and today I'm going to be talking about Wojciech Stambolovic's work on medical heresy and his article on the view of a heretic from the medical perspective. So let's get started. So, as a little introduction, Wojciech Stambolovic was a doctor who had pretty bold ideas about medicine and how medicine should be taken into effect when dealing with people. Um, his work, Medical Heresy, The View of a Heretic, is what I'm going to be covering. And it basically talks about how he tried to show his views on how he thinks that medical heresy has an orthodoxy and his thoughts on that. So, with all that being said, I'm going to just jump into that and talk about his criticisms and the critiques that he received from his work and his thoughts. So, Stambolovic is a Serbian doctor, and he wrote this article in 1996. And his big idea was that he believed the way medicine was being practiced was too rigid and narrow. And at the time, alternative medicine wasn't taken very seriously. And so he argued that it should be considered a valid part of healthcare. His work sparked debate among medical professionals as he wasn't afraid to challenge the traditional approach to healing a person. So, Stambolovic's research focused on what modern medicine was missing. He thought that doctors often treated the body like a machine with fixing individual parts instead of looking at the whole picture. And with this, he introduced the idea of the holographic paradigm, which is really just saying that everything in the body and mind is connected, and medicine should focus on the interconnectivityness instead of just treating the symptoms. And this leads to his scientific theory, which is centered around the idea that medicine should not be separate in the body, and it should be seen as the overall well-being. He believed that health could not fully understood with only the reduction method of science, which breaks things down into small pieces. Instead, he suggests a more holistic approach that one recognizes how different aspects of a person's life and body are interconnected. This was a big shift from the traditional method, which was focused more on specific diseases and isolated treatments for such diseases. But looking at the case, you can see a classic example of what happens when someone challenges an established system, because on one hand, Stambolovic's ideas weren't backed by the same kind of scientific studies that the traditional medicine relies on, so it makes sense that many professionals were skeptical on him. But on the other hand, medical has evolved over time, and many ideas that were once rejected, like the importance of mental health in a physician's well-being, are now widely accepted. His case reminds us that science is always evolving, and sometimes new ideas need time before they can be taken seriously with the given professionals. So, in the standard way of thinking with medicine, it's pretty straightforward to find the problem, treat it, and move on. So, Stambolovic thought this approach was too limited. He believed that to truly understand health, we need to step back and look at bigger picture and not just focus on one symptom or organ at a time. His ideas were different from what most doctors were taught, which is why they were seen as controversial and not understood for this day and age. So, Stambolovic's heresy, or what made his ideas so controversial, was that he took alternative medical seriously at a time where most of the medical world would dismiss it, and he argued that modern medicine was too rigid and that ignoring alternative healing methods was a mistake for that time. Many experts thought his ideas weren't scientific enough, but he believed that he could give patients more hope and better results. This put him at odds with a lot of the mainstream medical professionals. So, for this case, I'm going to be defining heresy as rejecting widely acceptable belief and going against it. And in some sense, Stambolovic was a medical heretic because he questioned the dominant approach to healthcare. However, was he really a heretic, or was he just ahead of his time? Because his ideas were so focused on a whole person rather than just symptoms, and are now becoming more common in medicine. So while his views were controversial in the 90s, they don't seem as radical today because we have thus moved forward in medicine and seen things bigger than they once were seen as. Even though he faced a lot of pushback, Stambolovic kept advocating for a broader approach to medicine, and he stayed a controversial figure, but his ideas didn't disappear. Over time, many people started paying attention to the kind of holistic healthcare he talked about. Today we see more doctors incorporating these ideas into their practices, showing that his work had a lasting impact, even though if it didn't seem that way from when he first started to talk about it in the 90s. He was definitely ahead of his time, and when he first wrote about his ideas in his article, most doctors did not take him seriously. They stuck with what they had been taught and did not see the need for change. But over the years, there had been a shift to holistic medicine, alternative therapists, and patient-centered care, and was much more respected. So even though his ideas weren't fully accepted back then, they helped open the doors, find new ways to think about health and medicine today. So yes, it was accepted, but just a delayed acceptance. And to just kind of piggyback off my last slide, yes, he was not taken seriously when he first said all these things, and was honestly kind of ridiculed and pushed to the side a lot of the time because people just did not want to think that way. But over time, and with constant speaking of the topic, yes, his work got more recognition and more people started listening to him, which helped medical as a whole because then people wanted to, learn more about it. So that's what happened basically. So Dr. Stambolovic took a risk by questioning the way medicine was being practiced, and at the time his ideas weren't widely accepted, but now holistic and alternative medicine have gained more respect. His work challenges people to think, should medicine science be more open to alternative ideas, or should we always stick to what the current system is? Or should we be willing to explore new possibilities? Maybe the biggest lesson here is the progress in science and medicine often starts with someone daring to ask tough questions and go against what's being known, to raise curiosity and enlighten new ideas to challenge what we already know. Okay, thank you so much. This is my works cited. Have a good day.